When I start reading about TB, about all the facts, that, you know, when my mom told me that she was in the hospital for 4 months way back then, you know, I thought I was going to be in the hospital for that long. And then they told me that, you know, the nurses and the doctor said that you have to spit into this little, to get your sputum, and if it gets negative twice, then, you know, I can go back home.
I took about maybe 20, 23 pills at a time. Yeah, plus the other ones that I had for this other condition I have. Like,
I had to take my pills for probably about 6 months, and that was like a lot. But the first couple of months, I took like about 22 pills, and then it reduced, and I was okay with that. But it's just too much pills. I can't. It's just, I don't like it.
It is true that people with tuberculosis have to take pills for months, but it's not the dreaded disease it once was. It's extremely rare nowadays that someone dies from TB, and people usually are not hospitalized for more than a few weeks. However, it is a hard disease to treat, and every effort must be made to control its spread.
they sent me to Stanton Yellowknife Hospital. And once we got on the airline, like, we had to wear face masks, like, and the nurse that was with me, we both had to use those. And when the stewardess started service, they wouldn't serve us because I was using those masks. You know, there's no awareness. You know, they probably thought I had AIDS or something. I don't know. You know.
I find it embarrassing because at that time, you know, I had so much friends, and, you know, just the fact that, you know, when the nurse asked me who were you in contact with, all the friends I hung out with, and including the ones in Red Deer, and right there I was just thinking, you know, they're gonna have to call all my friends, you know, in Red Deer too. You know, how embarrassing, you know, just to say that, you know, Faye had TB. I wonder what they're gonna think of me. That's how I felt. But then afterwards, after the thought of having TB, I was thinking, you know, it was good that they contacted all those people because, you know, I didn't want them to get sick as well.
Did any of them get sick?
No.
Did any of your friends get sick?
None of my friends got sick.
TB or tuberculosis tends to affect the young children more than let's say your average young adult or your adult who tend to be healthy. And the same will also affect your older population, but in young children can be very, very serious because their ability to fight infection isn't as good as when you're older. So our way of trying to prevent the young children from getting tuberculosis, a serious case of tuberculosis, is by giving them a vaccine. This vaccine is called BCG. They usually receive it within a few days after their birth, usually in the hospital, and we try to get all the children vaccinated in the hospital. Now, this vaccine is different from other kinds of vaccine in that it doesn't necessarily prevent the children from getting the tuberculosis. What it does prevent them from getting is a very bad infection where it'll spread to all the lungs or spread to the brain or different parts of the body, so that if they do get the tuberculosis, they're much less sick, and it's usually just in the lungs and easier to diagnose and treat.
Priscilla was the one that was contact with sickness, and when when she was first born, I was in the hospital, and I noticed that she didn't get her shot when the baby, before we get out of the hospital, they usually give a needle to the baby. She didn't get the needle, and I was looking, maybe it might get infected arm for that needle, but I didn't see nothing. And it could be because of she didn't get that needle that she got sick after when she came 5 years old. I didn't know it was TB until I took her to the doctor. So at that time, I really wanted to know that maybe it wasn't only her, so I took all my kids in and I put them into the hospital. That's when I noticed that they had to take pills, all of them.
It's not all the children who, or all the newborn infants who need the vaccine. In the north here, it's really only the children who are at high risk. And those who are at high risk tend to be our Aboriginal population, where there was a lot of tuberculosis a number of years ago, and not all of the people were treated. And so it's still around in the adults, especially in the elders. And as well, the immigrant population are at high risk because they come from areas of the world who still have a lot of tuberculosis.
For the average Canadian, tuberculosis has become a rare disease, but here in the NWT, the rate of infection in 2002 remained almost 5 times greater than the rest of Canada. Immigrants from countries that have a high rate of tuberculosis, such as India, South Africa, Southeast Asia, and the Philippines, also have a higher risk of infection. So this is why in the NWT we must continue to have an active TB surveillance program. In Ray, for example, a MAN2 test is given yearly to 5, 10, and 15-year-olds. Children and adults who are found to have been exposed to TB but not sick are asked to take 2 pills twice a week for about 9 months. Usually they take them in front of the nurse at the healthcare center or at home or at school. This is called direct observed therapy, or DOTS.
And we have periods of time where we'll have a number of cases and then other periods where we have no cases. But a big part of our TB program is TB surveillance, where we're actually looking for cases. And in fact, we're usually quite happy when we do find them because it means that our surveillance is paying off. The big groups that we look for are certainly people that have been exposed to TB in the past. They may have elected not to take pills to get rid of the TB that was in their lungs. Now, these are people who didn't have what we call active disease. They weren't infectious. If those people chose not to take medication, our screening program means pulling them in every year or every 2 years based on what their risk factors are, and doing chest x-rays to make sure that they're not developing active disease. And if their chest x-rays and sputums are clear, then we would relook at them in another year or 2. And that's sort of the crux of the TB surveillance program, is looking for people to see if they have actually gone on to develop full-blown TB disease. The other group that's at risk to develop TB disease are certainly some of the elders that we have, and some of the people with chronic illnesses or chronic alcohol issues, or things that sort of threaten their immune system, where it could break down and their TB could become active. So the surveillance program is really about trying to find TB.
The X-rays and sputum samples gathered in the communities are sent to the Stanton Territorial Hospital in Yellowknife. The results of the lab work there determine if any treatment is necessary.
With tuberculosis, has improved after treatment.
If someone doesn't take their treatment, then the germ may get better in the sense that that person won't feel sick anymore, but the risk for it coming back is very, very high. And unfortunately, if it comes back, sometimes it's then resistant to the antibiotic or antibiotics that they've been on, so then it's tougher to get rid of it. We have to use more unusual and often more toxic or pills that have more side effects to get rid of the germ.
I think there is some awareness, but I don't think everybody is aware of it, because too often I might see children who have been exposed to tuberculosis, and the story is that their granny or their aunt or uncle have been sick and coughing, and they haven't gone into the health center to be checked for tuberculosis. So I think what's really important is for adults or anybody around the young children, if ever they start feeling tired and start coughing a lot, then they need to go in and ask to be checked for tuberculosis, so that there's no chance that they can, if they have it, that they won't spread it to their family, and especially to the young babies in their family.
I usually call to Ray, and then that X-ray person would come with one of the nurse, and whoever can't get their MAN2s, get their X-rays and sputum.
My friends, they treated me just as a normal person, you know. They did know that I had TB, and they accepted it. You know, I had TB, but I'm taking medications for it, and you know, I'm cured.
Although more healthcare providers are better informed about TB in the NWT, it is also each person's responsibility to be informed about the risks of TB and get medical attention when they have a cough that doesn't go away. Screening, early detection, and treatment will stop the spread of TB. If it goes undetected, it can destroy lungs and other parts of the body. It can even cause death. So it is important to get checked if you have symptoms and screened if you are at risk. Stories like those in this video of having to spend months or years isolated in the hospital are history. Today, TB is much easier and quicker to treat, and people can be cured. With all of us working together, TB in the North can become a disease of the past.